Okay, first thing I'm going to do is wash my hands, and then I'm going to review the physician's order. So what I have here is my wound care order. It's for my patient Lucy Maragmo, Fin 123456789, date of birth February 16, 1957, Dr. Wilson. So today's date is February 3, 2022 at 9:30. Patient is admit to unit for left thigh laceration, change dressing twice a day as needed, cleans with normal saline, pack with normal saline soaked 4x4, cover with 4x4 abdominal pad, and secure with Mefix. Order's been double transcribed. So I've reviewed this order. I'm going to wash my hands and I'm going to collect my supplies. So what I have is an absorbent pad, a pair of clean gloves, and I have my normal saline and my actual wound care kit. So I'm going to carry all of my supplies to the patient's bedside. So upon entering the patient's bedside, the first thing I do is an entrance safety check, which consists of making sure patient's bed's in lowest position, her call bell's within reach, there's no fall hazards on the floor, and the patient's not in any pain and distress. So now I enter the room, and I close the door for privacy. Now I wash my hands. Hello ma'am, my name is HongYang Lin. I'm a University of Manitoba student nurse, and I just got the physician's order to do a wound care and wound assessment on you today. Is it okay if I first take a look at your wristband? So taking a look at the wristband, I see that it says Lucy Maragmo, Fin 123456789, date of birth February 16, 1957, Dr. Wilson. Great. Ma'am, could you please tell me your full name? Could you please tell me your date of birth? And do you have any allergies? Okay, so Ms. Maragmo, the reason why I'm here is we got the physician's order for us to do a regular wound care and wound assessment on your left thigh laceration. That consists of removing the old wound dressing and assessing it, and then we're going to irrigate the wound clean, and then we're going to dry your peri-wound skin, assess the parameters of your wound, and then we're going, after assessing, we're going to put on new packing on your wound as well as new dressing. So is this all okay with you? She says yes, it is okay. Before we get started, would you like any pain medications or analgesics? She reports a 5 out of 10 pain, so I do administer an analgesic, and it's been 30 minutes and it's taken effect. So that's good. She got the analgesic, and now I'm going to raise the bed up to my working height. So I raised the bed up to my working height, and now I'm going to wash my hands, expose the wound area, as well as put on my absorbent pad. So I have an absorbent pad right here, which I'm going to tuck under to absorb the irrigation splashes. And now I'm going to wash my hands and don a pair of clean gloves. So I don my clean gloves. I'm going to first remove the outer tapes. And I have my old wound dressing and packing here. What I see is a moderate amount of pinkish red serosanguinous exudate, and it has no odor to it. So I've noted that. I'll make sure to document it. And I'm going to take this off, remove my gloves, and wash my hands. So now I've noted that. Now I'm going to get everything I need. First I have my sterile gloves, and now I'm going to get everything in my wound care kit. I have my syringe, my medical tape, as well as my abdominal pad, and my Cathlon and my cotton sticks. Lastly, I have my actual wound care kit, which is fully intact with no damages. So the first thing I'm going to do is I'm going to open it, touching only the 1-inch border. I'm going to take out my blue pliers. Did you get it back for me? And I'm going to take out my garbage bag. There's still changes. I'm going to place my garbage bag at the bottom of the patient's legs, and now I will get my silver pliers. And now I'm going to get my normal saline first. It looks to be not expired, so I'm gonna fill the empty tray with normal saline.
So after doing that, I'm going to go into the patient's room.
And now I will get my 30 ml syringe, which I will fan back. And I'm going to put my syringe in here. And now I'm going to discard of this, and I'm going to get my 20 gauge IV Cathlon. So that's IV Cathlon got damaged, but I would make sure to please assume that never happened, and I would make sure to get my buddy nurse, and he would bring me a new IV Cathlon, but I'm going to just continue to toss this into my sterile field. And now I'm going to get my cotton sticks.
And then I would raise the height to waist level, but again for other purposes, keeping it at waist height. And I'm going to expose the dressing.
And lastly, I'm going to get my another set of cotton sticks.
And I'll do hand hygiene, and I'm going to put my clean gloves.
And I'm going to keep this as a measuring reference right here. And now I have everything in my field. I'm now going to keep my field in my vision, and I'm going to don a pair of sterile gloves. It almost touched the sterile glove again, but it didn't. I'm going to only touch the cuff. I have one sterile glove, as well as a second sterile glove.
So now I'm going to check the dressing.
And now I have my sterile gloves on. I'm going to touch the middle of this. Sterile on sterile is still sterile. And now I'm going to get my IV Cathlon out. There it is. And now I will fill this up with 30 ml of normal saline. And now I'm going to thread on my Cathlon.
After doing my assessment, I'm going to throw this out in the garbage. For demo purposes, I'm keeping it on the side. I'll get rid of my gloves.
I'm going to stand from 5 centimeters away and irrigate the wound.
Now I'm going to prep my supplies. So again, do hand hygiene. And then open using sterile technique. And with my forceps, I'm going to adjust the tray.
And now my normal saline is running fully clear, which means I've gotten most of the serosanguinous exudate drainage out. So I finished irrigating my wound, and now I no longer need this. And now I'm going to dry the peri-wound skin. So in order to dry it, I'm going to get my 2x2, make it into a rosette. I'm going to dry the skin outside furthest from me. I'm never going to dry the wound bed because it's going to remain moist for a good healing. I'm going to dry the peri-wound skin outside nearest to me. And I'm going to keep drying until I get all the moisture out.
And take it out, put it right here. Pour it in the garbage. 20 gauge Cathlon.
And lastly, one more swipe.
And if you left it, take it out. And then pour it out.
There's still a bit more. over here.
Same process.
And now it's fully dry. So now I'm going to assess the wound. And to assess it, firstly, just by looking at it, I see it has the edges of the wound are attached and well formed. The peri-wound skin is intact with no redness. The wound has no odor. The wound bed is pink granulation tissue, and there was a small amount of pinkish red serosanguinous exudate. So that is, and as we know, the patient reported a 5 out of 10 pain for the wound. Now I'm going to assess the dimensions of the wound. So I'm going to get a cotton tip applicator to assess the dimensions. It has a length of 9 centimeters, a width of 2 centimeters,
So
there's no tunneling.
do on hygiene again, and then wait for my hands to dry, and then wear my sterile gloves.
There's also no undermining, and it has a depth of 1 centimeter.
Okay.
Now I've assessed the dimensions and all the assessments of the wound, and I've dried the peri-wound skin. Now I'm going to pack the wound, and in order to pack the wound, I'm going to first need a 4x4, and I'm going to saturate it in normal saline. And now I'm going to make it, I'm going to take out some excessive moisture. And now I'm going to take a cotton stick, and that's going to help me pack the wound.
All right. So
And I'm packing so it's not too tight, but there's not an excessive amount of dead space either. So I've packed the wound, and now I'm going to put on my outer dressing. My outer dressing is a 4x4 first.
So now I'm going to prepare my syringe. Take out 30 milliliters.
And then
This is for irrigation. So take the 30 milliliters out.
a 4x4 followed by an abdominal pad. My gloves no longer need to be sterile. Here's my abdominal pad packaging,
Sharps container.
and I'm going to place it right here.
For now. And then
Lastly, I'm going to tape it. Despite the order saying me-fix, I don't have any me-fix, and I was told I'm allowed to use medical tape.
My wound, but before doing that, I'm going to touch the sterile part of the wrapping. I'm going to put it on the side, and then I may have contaminated my gloves just touching the side, so I'll get new gloves, and then I'm going to irrigate the wound 5 to 10 centimeters away, just like so. And I'm going to irrigate until the normal saline runs clear and the wound is clean.
And I'm going to tape the other side.
So once that's done,
And now I've taped up
I'm going to throw this out in the garbage.
everything in the wound here. I'm going to remove my gloves and wash my hands. And now I'm going to clean up everything here. That includes putting the needle and the pliers into the sharps. Thank you, Ms. Marangmo. If you feel any additional pain and discomfort at your left thigh laceration wound site, please ring the call bell and me or another nurse will come and assist you. But at the moment, I've finished doing the wound care and wound assessment on you, as you saw, which is irrigating the wound, drying the peri-wound skin, assessing the wound parameters, and putting new packing and new dressing on the wound. So that is it, and now I will do my exit safety check. So my exit safety check, I have already cleaned up everything here, including putting the needle and pliers in the sharps. The patient's call bell is within reach, and bed's in lowest position, call bell's within reach. Patient's not in any pain and distress, and there's no fall hazards on the floor, and everything's been cleaned up. I exit the room, and in my documentation, I talk about how I've reviewed the physician's order of us having to do a regular wound care and wound assessment on the patient's left thigh laceration. I did this in sterile technique. I explained the procedure to the patient. She tolerated it well. She reported a 5 out of 10 pain, so I gave her an analgesic before we started. I removed the old wound dressing and saw there was a small amount of pinkish red serosanguinous exudate drainage with no odor, and then I irrigated the wound with 30 mLs of normal saline. and then I dried the peri-wound skin, and then I assessed the parameters of the wound. The wound had length 9 centimeters, width 2 centimeters, depth 1 centimeter, no tunneling, no undermining. The wound edges were attached and well formed. Peri-wound skin was intact with no redness. The wound had no odor. The wound bed was pink granulation tissue, and the wound had a small amount of serosanguinous exudate. And as we know, the patient reported 5 out of 10 pain for the wound. After I dried the peri-wound skin and assessed it, I then put on my packing, which is a 4x4 soaked in normal saline. And I put on my outer dressing, which is a 4x4 abdominal pad and then taped up. And my plan for now is just to continue twice a day as needed, as per physician's order, regularly care for the wound, which is irrigate, dry peri-wound skin, assess, put new packing and new dressing on. And each time I do it, I'll make sure to assess the wound parameters and assess the patient's pain tolerance level to this left thigh laceration. Thank you.